Well, good afternoon, everybody. Welcome to our webinar for Albizu University. We have a wonderful panel, and we're going to be addressing a wonderful topic. We're going to introduce our panelists. We're going to ask them some questions. You're going to get a chance to ask your own questions at the end. And basically, the topic is pushing through or making a boundary when your mental health needs are at jeopardy. So let's begin. My name is Dr. Scott Bauer. I'm your moderator, and this is the third episode of Albizu University titled Ask the Experts. It's a webinar series that's been running. During the next hour, we will analyze the notion of athletic grit. Should we stick in there regardless of the consequences, or should we back off for mental health? How physical injuries, we back off until they give a cortisone shot and make you go do it and ruin your leg or arm or hip for the rest of your life. But mental health is an unaddressed issue, kind of like concussions in the football field years ago. How it relates, athletic grit, the benefits, the dangers associated with traditional sports strategy of powering through. Be strong, power through. Yeah, and then we're done with you, goodbye. Now you're disabled for the rest of your life. Yeah. When is it time to say stop? I need a break. Should we power through the physical, psychological barriers? This is just not for sports. This is for everybody. Professionals, doctors, masters, students, mothers, fathers, children, everybody, policemen, policewomen, firefighters. I would like to introduce our wonderful panel. We have 4 panelists today. They're all part of the Albizu campus, Miami campus facility. We have 3 practitioners, faculty members, undergraduate, graduate, master, and graduate doctor level. And we have a special guest of a student who graduated from the master's mental health track. And he's going to help join us with the rest of the faculty. Let's start with you. I'd like to introduce Dr. Jessica Popham. Hello, Dr. Popham. Welcome.
Hi, thank you. I'm very excited to be here. Thank you for having me.
So let me introduce Dr. Popham a little bit. It's great to have you here. Her background is she's a licensed marriage and family therapist in the state of Florida. She's a full-time faculty member and the newest and latest in our faculty team, and a practicum coordinator for the marriage and family therapy track. She teaches, supervises, navigates, guides, nurtures, and mentors our students in the Master's in Psychology program. Her special topics include anxiety, trauma, depression, parenting, grief, loss, and overall family dynamics. Because just because an individual is suffering, does that mean the family system is not suffering? And Dr. Popham will back me up in the future. Oh, I'm not going to ask her this yet, but imagine the individual is the identified patient, but the family system is actually the problem itself. Dr. Popham's focus today will be on the impact of sharing mental health struggles publicly. Looking forward to it, Dr. Popham. Our next panel guest is Dr. Isaac Tourgeman. Did I pronounce that right, Dr. T?
Yes, you did.
Finally, hallelujah. Welcome.
Well, thank you for having me. It's a pleasure to be here.
You all remember Dr. Tourgeman from our previous webinar. He's a neuropsychologist, full-time faculty member at Albizu's Miami campus, co-coordinator of the university's neuropsychology track in the doctorate level. Dr. Tourgeman is the staff psychologist at the Design Neuro Center and the Neurotrauma Service at Kendall Regional Hospital. Busy, aren't you, Dr. T? Dr. Tourgeman is a certified brain injury specialist with a significant part of his practice being devoted to seeing individuals with concussions, as I previously mentioned. So maybe if we have time, we could add the issue of concussions with football players that was not being addressed. And our third panelist is Professor Yamila Lascano. Welcome, Professor Lascano. You're muted, Professor Lascano.
Just happy to be here. Thank you for having me.
Let me introduce her and give a little background. Professor Lascano teaches classes at Albizu's Miami campus for the Albizu undergraduate psychology and educational program. She is also a licensed mental health counselor with a private practice in Miami. She's the program director for the federally funded Miami Mental Health Awareness Initiative and a frequent contributor to Psychology Today. Professor Lascano has extensive experience in infant mental health, very unusual, Professor Lascano, and early childhood developmental disorders. Wow, nice. Very good. And our last fourth finalist, final panelist, sorry, we're not in a contest. Final panelist is Orlando Castro. It's a pleasure to have you today, Orlando. Welcome.
Thank you, Dr. Bauer. Thank you for having me.
A little history on Orlando. He was one of our graduates of our mental health track in the Master's in Psychology programs. He was actually under me as a supervisee for his practicum. He's graduated and blossomed, and here's his achievements. I'm so proud of you, Orlando. You are a product of what we hope for.
Thank you, Dr. Bauer.
Orlando is a licensed mental health therapist and a proud graduate of Albizu University, Miami campus. He currently serves as a private practice family counselor and the director of the adolescent unit at Larkin Hospital of South Miami. A little stressful there, Orlando. He works with unaccompanied minors to coordinate mental health services and family reunification. Over the 25 years of experience, Orlando has worked with elite athletes as a sports mental health professional, and just recently as a federal field specialist for the Department of Health and Human Services. Wonderful, Orlando. Wonderful achievement. Good to have you.
Thank you, Dr. Bauer.
Now that we introduce our four panelists, our plan is now to hear from our panelists first and save the last few minutes for questions from you all, the audience. As the discussion proceeds, I would like to encourage our viewers to please submit your questions through the Zoom chat function. Let's go ahead. Let's start. Let's put discussion forward and put everything into context. Star athletes, as you recently saw in the Olympics, like Simone Biles and Naomi Osaka, made international news for their mental health challenges. The first time in history, an athlete said, I can't, I'm not good. It never happened before. As well as their comebacks during the recent Tokyo Olympic Games. Mental health is very important. When you know you're not mentally healthy, you're not in a good place. If you don't do anything about it, you will deteriorate. You may bounce back, but you will deteriorate. If you don't fix your car engine, when you hear ping, 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 it will deteriorate. And then eventually you're gonna be stuck on the side road, 195, calling AAA, if you have. If you don't, you're in trouble. Mental health is the same. It's your mind, it's your body, it's your physical, it's your spiritual, it's you. Mental health, that's why it's called mental health. And most of you, hopefully, that are in visiting us are in the mental health field and have to understand this because you're going to be a provider and or you might even be someone who's a patient, was a patient. So it doesn't matter. What matters is that you understand the need to attend to the issues. It doesn't go away. So we saw them bounce back in the Tokyo Olympic Games, but some wondered what happened to the good old-fashioned push through, achieve that goal. Having grit and overcoming challenges is an American tradition. With all that added pressure, many questions arise, such as how can you possibly know when it's time for mental health self-care? Key term today, self-care. Do these athletes get mental health treatment? When is it time for the cry for help? When is someone going to listen? When are you going to cry? Because if you show weakness, you're going to be considered weak, but it's not weak when you cry for help. If your dog or puppy cries for help, do you ignore it or do you take it to the vet? I'm not calling you guys dogs or puppies or athletes. Every living thing, mechanical things, needs attendance. Do we work in preventive care or we have to deal with aftercare? I was raised by a medical doctor, cardiologist. He was a preventive care specialist. All I saw in life was aftercare problems. If we attended to preventive care, we wouldn't have so many aftercare issues. So we're going to start with you, Professor Lascano. I'd like to begin with a very generic question. How common are mental health disorders for athletes?
Well, I would like to start by saying that how common mental disorders are in general. Mental health challenges, as with physical health challenges, affects everyone. In fact, mental health problems are more common than heart disease, lung disease, and cancer combined. And actually, 1 in 5 Americans was estimated that will have a diagnosable mental disorder. However, mental disorders are often underdiagnosed, undermanaged, and worse ignored. Now, in the case of athletes, several factors, trigger mental health-related disorders. We have to take into consideration that athletes undergo high-intensity trainings, difficult competitions, having to relocate away from the family, from their support system, from their friends, and they live an overall stressful lifestyle, which adds to the risk factors that could exacerbate the onset of mental disorders when compared with everyone else. Now, if we add to the risk factors for mental disorders to youth, to young adults and adolescents, we have to think that a lot of these athletes start very young. So we're looking at the age group 16 to 34. We find that the vulnerability to mental disorders for this particular age group, 16 to 34, it tends to be 25 to 26% higher compared to other age groups. We know, as I said before, that a lot of these athletes, they start very young. They often miss important developmental milestones as far as the social domain, like participating in activities outside the sports environment, or even attend school. A lot of them, they practice extended hours and their home school. So a lot of these, type of experiences could add to the risk factors associated to mental health challenges, as they experience stress and pressure to perform at highly competitive levels at very young ages. And if we think at the level of pressure between, individual sports versus, collective or team sports, I think that individual sports like tennis or gymnastics could even trigger like a higher performance pressure. And also looking at research, it shows that many athletes often suffer from mental disorders with similar higher percentages to the normal population, right? And a lot of this actually, if we look at eating disorders, there's a high incidence of eating disorders or substance use disorders in elite athletes, which surpass those in the general population.
Wonderful. Very good, Professor Lascano. And I would also think that the academic stress for students to achieve, getting to college, 4.0, 5.0, I need a 7.0 G, whatever this bar keeps being raised. And what about the kids with disabilities? They can't get that bar. Let me do a follow-up question with you, Professor. So since high performance athletes promote a culture of extreme focus on fitness and physical endurance, how do you think this might contribute to the stigma that's related to mental health challenges for athletes?
I think that part of the issue is that mental health has a stigma associated to weakness. And that's totally the opposite that athletes might want to portray, giving the perception to the society that they are immune to such problems. And hiding vulnerabilities can reinforce the stigma around mental health. We have to take into consideration that athletes are often idolized in the media by their fans. And this put them in a very difficult position as role models. And they also receive big endorsements, right, by a lot of the sports companies and non-sport companies to promote in the media. So this adds also to that pressure. So we tend to assume that looking fit, it's related to good mental health. And of course, there is that mind-body relationship. Working out, it's wonderful. It has a lot of benefits to the overall health. But in the case of, high performance athletes, they often endure psychological pain related to that high intensity training, performance, the expectations from the coaches, from the teammates, from the general public, from the fans, and also additional psychological pain is experienced, for example, when they're recovering from an injury that might put them at risk of impairing their athletic performance or even their professional career. And at the same time, symptoms of mental health related disorders may set back an athlete's recovery of mental health related disorders. An athlete recovered from an injury. And for example, we saw in the Olympics, Simone Biles, she made the decision not to participate in some of the games or part of the Olympics, not until towards the end. And it was because of her level of confidence. She didn't feel confident enough. She was afraid that it will trigger an injury. And we know, especially in gymnastics, an accident, that particular sports could be quite detrimental. Also, it's not uncommon for athletes to have dedicated many years of their life to the sports and who have suffered serious physical injuries which have negatively impacted their career. As a result of that, suffer from depression, from anxiety, from substance abuse. So I think that the recent events from these high-profile athletes prioritizing mental health, such as back in June with Naomi, Osaka, the tennis player, and Simone Biles during the Olympic Games, has certainly triggered an important shift in the narrative of mental health in sports.
Professor Lascano, you brought up an interesting term, psychological pain. It's very rarely used. Can you briefly describe that?
Psychological pain, it has to do with that struggle of the individual trying to still keep an image that they're able to, perform at the same level that they used to perform perhaps prior to that injury, but not being able to say anything. When we talked about a stigma, unfortunately, that brings a lot of isolation, a lot of fear of judgment. So they're enduring this psychological pain, this feeling emotionally overwhelmed by not only, enduring this physical pain, but at the same time, feeling that they're not able to perform at the same level, being afraid perhaps to suffer another injury.
And they need to look good.
You need to look good.
Looking good is very important, right? Physically, emotionally, psychologically, look how good I'm doing. But inside they're screaming and dying. Get me out of here. All right, thank you, Professor Lascano. Let's move on to Dr. Tourgeman. Dr. T, let's discuss how physical issues for amateur and professional athletes relate to mental ones. Can you please first explain adrenal fatigue and what impact it has on one's general status?
Okay, so adrenal fatigue is a term used to describe a situation in which your adrenal glands, which are very vital to our stress response, essentially become overtasked because of continuous use, basically being in chronic stress. So they lose their efficiency, leading to symptoms such as fatigue, feeling tired, mental fog, as well as the onset of symptoms associated with depression and anxiety. This tends to come about in situations where individuals are constantly dealing with stress, such as when they're required to perform at a high level, as we see in athletes, both amateur and professional. Again, this is a situation in which the individual is constantly asked to perform at a high level and dealing with all the stressors that come along with it. So in these types of situations, the body is overwhelmed and over time begins to respond by essentially, breaking apart a little bit. So the efficiency of our system, essentially our sympathetic system, becomes overwhelmed. So I do want to comment that our stress response is natural and vital to our survival. So we need our bodies to kick into gear anytime we experience a threat. So our brain activates what's called our sympathetic nervous system that basically tells our body to get ready. That's fueling blood to go to the appropriate organs, getting our muscles tense to react, even increasing our heart rate. And this is important to get away from that stimulus, from that threat. But when it's ongoing, our body loses its natural homeostasis, its balance. So glands like our adrenal glands become overwhelmed because they're constantly firing in high gear. Therefore, they lose their efficiency. And the result that we're intending to have, which is our ability to react to a situation, no longer has that effect.
So the sympathetic fight or flight system is always running on high octane. So it has to burn out like an engine. So if I'm revving my engine all the time at 90 miles an hour, rah, 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 and then I pass out, I get up and do it again, I'm going to break down. So I'm not listening to that internal cue to back off, rest, and get that homeostasis again.
Exactly.
Huh, very good. One more question for you, please. Can you expand on the relation between physical injuries and concussions and mental health in sports?
Okay. So concussions have often been called a silent epidemic because different from, let's say, a fracture or dislocation that's very obvious or a lesion that leads to a wound, concussions are often not as obvious. So by definition, a concussion is what's called a mild traumatic brain injury in which there's a change in mental status. That could be a short period of confusion, loss of consciousness, or other changes in your brain function. Now, what happens afterwards is the individual may not truly be aware that an injury has occurred. So it's very, very important to those around that they evaluate the individual and see if a situation has occurred. Luckily, nowadays in sports, people are much, much more attentive to this. Now, the majority of individuals with concussions do get better, but there are some in which lingering chronic symptoms do come about. Now, that can be secondary to a multitude of factors that I'm not going to go into the specifics, but understanding the presentation of concussion leads us to better understand how to best intervene with these individuals. Now, in the short run, concussions can lead to, like I said, changes in mental status, but what really is that? Well, maybe the individual has that mental fog we talked about before, not remembering as well, difficulty concentrating, dizziness, vertigo, also feeling overwhelmed. The brain reacts to this trauma by basically erupting with all the chemicals within it. Essentially, the chemicals associated with getting your brain excited to react, as well as inhibiting function, go where they're not supposed to be. So that homeostasis we talked about before is lost. Luckily, in most individuals, this is a brief period of time in which, again, the body is able to recover, but it's necessary that this is dealt with properly. In situations where it's not, individuals that could have recovered quickly now have a prolonged course and typically end up in clinics such as mine.
So, Dr. T, but if the change of mental status is not immediate, they don't recognize it. But what if it's delayed years from after they've done the sports?
So that's a very important topic too. So as part of my practice, I see a lot of individuals with what's called chronic traumatic encephalopathy, CTE, which is a diagnosis that's gotten a lot of popularity in the last decade associated with football players. And so sometimes there's subclinical concussions, ones that don't really make the person notice or those around them, but over time they build up and can potentially lead to problems down the line that could look like they're degenerative, similar to a dementia, such as Alzheimer's. Now, I do want to say that not everyone experiences this, but the more concussions you have over time, there's a potential that there is going to be an effect. So again, it's very important that we take injuries very seriously. Now, everything we've talked about is added on to that, the stressors of performance, things like our body's reactions to stress. And then if you add on to it the injury that may not seem as obvious, individuals are oftentimes compelled to keep this within themselves and not express that they're noticing these changes because they don't want to appear weak. You know, weakness on the field or on the court is defeat. You know, it's reducing your play time. But if we don't understand these factors, then it isn't the coach or the opponent that's going to reduce your playing time. It's going to be your body. So we have to pay attention so our bodies don't break down on us.
And what you're describing, Dr. T, is internal damage or insult. But if they don't see it, nothing's wrong. So it has to take someone to recognize it, or the individual to say, hey, I'm having a problem here. Something's wrong. Oh, walk it off. No, I can't walk this off. Very good, Dr. T. Thank you. Very good. Let's move on to Dr. Popham. All right. So, Dr. Popham, it seems that every day people use the word power through these words, these challenges in the past in their efforts to succeed. But lately, especially, so many athletes are talking publicly about their mental health issues and social media, making athletes, their personal lives public, and there are new challenges and considerations to deal with in regard to the mental health. What are your thoughts about the impact of someone's private mental health struggles that's being aired publicly, whether that's voluntary or not?
Yeah, so I think sharing our private mental health struggles publicly helps to decrease stigma first. It takes a topic that was once and still is very taboo and makes it less intimidating. So when other people are sharing their struggles, especially celebrities or people in the spotlight, we realize that we don't have to hide those parts of ourselves either or feel like we're alone. It also helps to foster conversations such as the one that we're having today, which can lead to better access to education, information, and resources. People can be linked to support systems, both personally and professionally, whether that's being able to talk to friends and family more openly or talk to a medical provider or mental health professional. Now, when someone volunteers to share their mental health struggles, they have more control versus when it's shared without their consent. So they can decide how much to share and when they're ready to share. However, if it's not voluntary and they're either forced or pressured to share, this can end up being more harmful than helpful. The person could feel angry at having to disclose when they didn't want to. So regardless, though, of how the information is shared, there are some common difficulties that people can still face as a result of just sharing their private mental health struggles. One of those difficulties is facing stigma and discrimination from others who just do not understand or do not support mental health. Also, a lot of negative and dismissing comments, especially on social media, from family and friends even, can take away from the support and acceptance from others. Also, especially for those in the spotlight, but also for those who are not in the spotlight, there can be that additional pressure to appear as a role model for mental health and to show improvement. So this can then lead that person to worry about any future struggles they may face and deciding how to navigate that process publicly. So they could feel like they maybe let someone down by relapsing or struggling, especially after making progress and improvement with their mental health.
Very good. I'd like to follow up with a two-part question. How has this mindset affected those of us who are not athletes?
Yes. So the mindset of powering through can affect anyone, whether they're an athlete or not. Oftentimes, this is something we learn from our families of origin growing up, or also just from our culture and our society. So especially in American culture, where there is a big emphasis on achieving your dreams and doing anything you need to accomplish them, we think that if we can just push through the exhaustion and stress, that it'll help us to achieve that next level of success, and then we can rest. But often it comes with more accomplishments to power through in order to achieve or even maintain that status. So we need to learn how to take care of ourselves throughout the entire process, rather than waiting until after we power through and then think that we have earned a break. This is what we call burnout, when we feel exhausted emotionally, physically, and mentally. And again, this can affect anyone, regardless of being an athlete, a public figure, or regardless of someone's career.
And the second follow-up, do you think the recent trend in mental health, in the mental health field, and self-care for professional athletes will transfer in the general life?
Absolutely. I think it already has. We've seen the recent rise of advertisements for mental health services promoted on major media, especially by athletes. It helps to show that these struggles are okay to have and that you don't have to be ashamed about them. And it also shows people different ways that they can access help, such as different therapy and mental health services.
Very good. Thank you. And now let's move on to Orlando Castro. So you're actually in the sports field and treating athletes directly, yeah?
Yes, sir.
Very good. Let me ask you some questions. Based on your vast experience in working in the professional baseball players, I believe that's what you work with primarily, and other athletes, tell us about the relationship between powering through and substance abuse, Orlando.
Our favorite word, self-medicating, huh, Dr. Bauer?
Self-medicating. What is that, Orlando?
Self-medicating. Well, first of all, thank you for having me here. And from hearing all these great panelists, it covered every piece of it, of what I deal with when I talk to these individuals and some of these professional, not only professional athlete, but collegiate athlete. And the key word is powering through. How do they power through? They present very well, but their stressors are multiplied times 10 when they're signing contracts that they want to add zeros to. So when they add these contracts, what happens is that their anxiety grows so much that a lot of them lead to and transition to substances. And some substances that I've been dealing with, that I work with, is the Adderall, because it helps them. Like, I talked to one individual specifically that he sees 100-mile-per-hour fastball, which is now that's what everybody throws in the big leagues and in college. He sees it like a basketball. So that problem, so then what happens is they get addicted to that substance, and then that leads to other issues that offsets their underlying issues that they have. But like some of the panelists were saying, these athletes right now themselves are lowering the stigma, because the stigma is so big, like you had said earlier, Dr. Bauer, that not me, I'm a professional athlete. I can't suffer from performance anxiety. I can't suffer from depression. Not me, I'm a professional baseball player. But you'll be surprised how many go through that, and specific to the ones that I'm working with now suffer on a day-to-day basis that they can't push through. Luckily now they have mental health skills coach that work with these teams, and they help work with these players.
Wait a second, Orlando. You're telling me that athletes are using substances to get to the next level? Psychostimulants, steroids, opiates? Come on, Orlando. That's addiction. Not real.
The ones I work with are none of the above, but though they use the Adderall to try to help them concentrate and see the ball better. And in their minds, they think that they're going to perform better, which is going to mean they're going to have a longer lasting career if they continue to do that. But the problem is, and then that problem leads to another problem. Then they're not sleeping. So that leads to another issue to self-medicate with another medication to sleep. So by the time they wake up and they're ready, because this is a business, once they become and they sign that contract, like Ms. Liscano said, a lot of these kids that are being drafted are being relocated to a city that the restaurants close at 2 o'clock. So they don't know where to eat. They don't know when to eat after the game. So it's all these stressors at once, and they still have to perform. The key word here is pushing through, and how do I perform at that level? It could be minor leagues, it could be big leagues, it could be collegiate. You know, we have a kid that was supposed to be a highly first round, second round pick. As soon as he opened up Twitter, as soon as he opened up the newspaper and he was selected as the number 9th pick in the draft, his whole life crashed through because he got so anxious that he became so performance anxiety that he couldn't perform. So that is where, like all the panelists are saying, that it's an internal fight and fear that they have within themselves. And they start at an early age, because when the baseball players, at least, they start at 6, 7, 8, and it's fun. It's a fun game. Once you get to high school, go to collegiate, the pressure from the parents, the pressure from the colleges, it's not fun anymore. So they take away the fun, they have to perform, and they're gifted with a gift, a talent that they have. But we forget, because the scouts always look at their physical performance. Can they run? Can they throw? Can they catch? Can they do well at school? Can they stay at school? But nobody looks at the mental health and what underlying issues they've had in the past, and now what offsets that because of all the pressure that they're on now. Because this is a daily pressure. Once you sign, you have a schedule from 7 a.m. to 7 p.m. You're bunting, you're working, you're throwing, you're catching, you're fielding. So it's nonstop, and they're competing with another draft. They're competing with other players because it's competition. So you have to perform, and they want to get to the next level. So it's constant performance and competition, constant performance and competition.
Because if they can't cut it, they'll be replaced.
In 2 seconds. They will be replaced in 2 seconds, because there's another player waiting for them in the bench to take their position, and there's another draft. There's a draft every year. So that specific team, they will get another player, or they'll draft 2 or 3 players that will take that position if you're not performing. So the bottom line is you got to perform, which leads to all the underlying issues of the mental performance anxiety that they go through. Right now in the playoffs, that it's very live, there's an individual in the big leagues that finally helped us through the stigma and came out publicly and said that he suffered from performance anxiety and depression, and he got the right help and he's powering through it.
So how often do you see burnout with these players, Orlando?
I see it it's very common, because what happens is what I said earlier, once you get to that level and you don't enjoy it anymore, they're burnt out. So there's no self-care in that at that level. There's no self-care, because you might have a day off between 162 games, you know, and then you have another day off. So I mean, it's just, you got to be always on your toes. You got to be always performing, not only physically, like some of the panelists says, your physical body shuts down, but their mental component shuts down, and they just burn out, and some of them quit the game.
One final question for you, Orlando. So how does all of this apply to everyday people? Because we talk about sports and athletes, but try to generalize to everyday people, because you see these kids in Larkin at your lessons. So try to generalize it if you could.
You know, Dr. Bauer, that's a great question. They're all interconnected, because the kids that I see at Larkin have underlying depression, have anxiety. They have the same thoughts. The only thing is, the difference is that they still have stressors. They have school stressors. They have relationship stressors. They have parent pressure. So all these stressors are the same stressors as athletes, but just times 10 with the athletes. With the everyday individuals, they go through the same thing that I would say you and I go through. Same stressors that we have. The only thing is how do we deal with it? But with the kids I see at Larkin, that is 80% of the kids that we see with depression and anxiety due to school, family, and relationships.
Guys, I'm going to put you all on the spot. How do we deal with stressors and pressure in our self-care? We're the experts here. Huh? Anybody want to volunteer? Then we're going to go on to some questions from the audience. Go,
I can
Dr. T.
and then
Wait, hold on,
Dr.
hold on.
You want to go first?
No, you go.
Ladies first, Dr. Popham.
Thank you, Dr. Bauer. So when it comes to us as professionals, as faculty, as mental health practitioners, we have to practice what we preach, right? We tell our clients all the time, self-care, 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 and we have to look inward and also do that for ourselves. So for me, I think it's about knowing yourself and listening to your body, because what might work for someone else for self-care and managing stressors might not work for someone else. So you have to know what works for you, and that might be a trial and error process where you try out a new routine or a new schedule or a new activity or hobby, and you see if that helps, decrease those stress levels. And if not, then you try something else. So, if sleep affects you and is a reason that you're being more stressed, maybe keep a sleep schedule, don't overwork. In terms of your time, things like that are things that you could do to help manage some of that stress, especially related to sleep, which is such a basic function that we need just to operate on a very basic level. Talking with someone and just doing things that you enjoy and that bring you energy.
Dr. Popham, you're not under stress. You're a full-time faculty, you have a private practice, and this program is not demanding. You seem to have it together.
Yes, it might seem that way, but again, we all have struggles. We all have our days where we need a little bit more attention and self-care than others. And being able to acknowledge that personally or publicly or both is so important to say, hey, my away message is on for the days that I'm off of work. And I will respond when I come back to work next week, unless it is an emergency. And so that's one way I also like to show my students that, we also need to take care of ourselves and put in those boundaries to help manage stress as well.
Boundaries, good word. Dr. T, would you like to share from you?
Sure. I think on that note, I want to extend to, I believe balance is the primary key to dealing with stress. We often categorize stress as a bad word, but we need to know that stress can also mean a good thing. We stress about what we care about in our daily lives, whether it's stressing for the exam that's upcoming, that board meeting that's going to determine your job, or that contract that you're going to be signing that's going to mean a lot of zeros next to your income. These are things that are of meaning to us. So when we stress about something, it's a good way to reframe it into thinking that this is something that's important. I need to pay attention. Now, as far as coping, I go back to the notion of homeostasis and balance. Our bodies know the key. It's just sometimes we don't listen, and our everyday lives is the same thing. Whether you're a high-performing athlete or you're an individual working 9 to 5, a student trying to make ends meet, this affects us all. And we can all say differentially that for the past couple of years, we've all been dealing with a heightened level of stress. So we've had to get pretty creative, because a lot of the activities that, maybe we took for granted and oftentimes put off, we didn't have the same level of access. So we had to kind of reevaluate what is of importance in our lives. But if we go back to the notion of having that balance, whether it's turning off your notifications, not responding to that email, putting down that pen, or saying, you know what, I've done enough for today, I can go home from the field. These are all important designations. So I think finding balance and then having a routine that you can always go back to. There's a lot to be said about the ritual, basically something that you just keep doing becomes part of your life. Having healthy activities that aren't meant to be a treatment, essentially, oh, I'm running because I want to feel good or deal with stress, but something that you intrinsically enjoy is very, very powerful. And then having kind of your toolbox of items that you can go back to, that you can always say, okay, if I need to ground myself, I can do some deep breathing, or I can read a book, play music, go for a walk, or talk to someone to kind of let it out. These are all things that we can put into play. And you don't have to be a professional athlete or even a collegiate or amateur athlete. You just got to be a person that's converting oxygen to carbon dioxide. And as long as we want to keep that going, we need to focus on stress because it's part of our lives. So life without stress is not really life. So as long as we notice that and we make it something that we pay attention to, we can deal with the moments that, yeah, maybe one day I'll be overwhelmed, but the next day, let's try to do a bit better. Okay.
So I'm hearing from both of you personally, self-care, mental health days, turn it off, go do something else, do something brainless, helps us rejuvenate and get back. Anybody else want to share, Orlando or Professor, what you do, or you don't have to? I put you guys on the spot.
No, I mean, just basically I agree with everything that has been said. I think also when it comes to our profession, mental health practitioners or clinicians, maybe some people have that pressure of feeling that, as you said before, we have it all together. And the fact is that we're all passengers in the train of life. We're not exempt from a loss. We're not exempt from grief. We're not exempt from, stressors at work, financial stressors, you name it. And I think it's, as Dr. Tourgeman said, is trying to identify when you're losing your balance, right? And what are those things that bring you pleasure? What are those things that help you ground yourself? And, and especially, recognize, that's the number one, recognize the signs and symptoms of burnout in you and what to do about it. And as, all have been through a lot in the past almost 2 years now. Having that resilience, that adaptability, right? And also nurture your support system. If you don't have a family support system, reach out to friends and nurture those friendships, because we live in a society that we tend to reach out when we have a problem rather than nurturing those relationships, right? So when we need them, we're able to, get what we need, and we're able to, help each other.
Very good, thank you. And Orlando, you want to add, or we can move on to the audience?
I just want to add shortly that I think that what the panelist said is I agree with 100%. And it took me a long time to learn boundaries and shut down. Took me a long time. So we practice this and we preach it, but we don't do it ourselves. So, for self-care for myself, I totally have my moments that I just disconnect. And I set boundaries so that unless there's a crisis or an emergency, then I attend to it. But everything else, I enjoy my grandson playing baseball. So that's my therapy, and that's where I shut down.
Very good. Thank you guys for sharing your personal strategies. Let's go to a question from Priscilla. I am an Olympian as well. Ha ha. How do I manage stress? How do you manage stress when you have a pre-existing condition like autism, for example, which puts you in a burnout, good word there, Priscilla, situation, often due to environmental or external factors? Who wants to tackle this one? Come on, guys. Push through.
Yes, as Priscilla is saying, when you are in the spectrum, there's many things that, different to the general population that could cause, stress, additional stress and anxiety. We know the sensory issues. So when it comes to the environment, whether it's something visually, overstimulating or auditory overstimulating, that, in itself could be, an anxiety trigger. but also being in social situations in which we don't know how to interact, or we don't have the appropriate tools, that also triggers anxiety. So I think it goes back to what we said before, trying to identify what works for that individual. We're all very unique. So what are those things that work for you in terms of, picking up on the signs of the anxiety and being able to find your, calming point, how to relax, what do I do in order to regain that balance and reduce that anxiety? So I think it goes back. And when we're talking about a young child with autism, I think it goes back to, those around that child, the family system, to be able to identify what are those situations that trigger anxiety. What are those not only social situations, but like I said before, in terms of sensory issues that might trigger and anticipate, a lot of anticipation when it comes to situations or events like that, and how to help that child to reduce that anxiety and be that support person for them. I don't know if that answered the.
Very good, guys. Let's move on to another question. I'm sorry, I don't know who wrote this, but it's a good question. Do you believe Taekwondo athletes between the ages of 10 to 15 face psychological stress or mental fatigue when asked by their coaches and parents to lose weight so they might be in a more favorable fighting division? Look good, look good. Anybody want to tackle this one?
I could help with that one. Absolutely, it could have a psychological effect on these kids, especially at the age range that the question is asked, because we go back to what Ms. Lescano had said. Then eating disorders, we got to look good. Well, you got to lose weight to fight at this weight. So then that starts to trickle down into the mental component, that they're saying, oh my God, I'm not good enough the way I am. I'm not good enough how I look. I'm not good enough on my weight. So, that definitely will have an impact, because the coaches really don't work with mental health. They just push and push and push to get performance out of these kids. So at that age, that such young age, it definitely could make an impact that could lead to other disorders later.
Yes, Dr. T.
Yeah, I just want to comment that that's often overlooked quite significantly, the prevalence of eating disorders amongst athletes. I mean, we don't consider that wrestlers, martial artists have to make weight. And this is very much ingrained at an early age, just as the question alluded to, but this continues on. And even in other sports, such as football players and so forth. So oftentimes we have like this idea of what eating disorders tend to present like, but in athletes, it's very, very different, because it's something selected for competition. So it kind of gives you that edge. So you overlook your body's natural drives to eat and maintain itself in order to hypothetically perform better. So I think that this is an important topic, and I'm very glad that Orlando brought that statement forth, because we oftentimes don't talk about eating disorders within athletes and competition.
Good. Sounds like we have a clinical doctorate in the audience. For someone obtaining their Psy.D in clinical psychology with no experience working with athletes, do you recommend special certification such as CMPC? I don't know what CMPC is. What is that, Orlando?
That's a certified mental performance coach. And yes, a lot of what we call, especially in Major League Baseball, the mental health skills coach. They want you to have the degrees that we have, but they also want you to certify in the CMPC. It just focuses more on the sports medicine, the sports psychology of the game. So it is highly recommended that it will look better when you go in and if you're applying if they're interested in that position, they do ask for that.
Very good. Thank you. Where are we? It looks like we have a school psychologist in the audience. As a school psychologist, I'm interested in incorporating sports to children's mental health. It's a very good intervention. Can you speak on the benefits of sports in children and how to balance the competitive nature of sports with personal and social development? Silence is indicative that it's my turn. I'm a pediatric mental health provider. I've been working with children for over 25 years. If you can get the child to do everything they want to do, they will feel more fulfilled as they're developing their athletic skills, their academic skills, their social skills, their cooperative skills. And it doesn't matter if they have a disability. What matters is that they are interacting with others, especially siblings, with each other, and children that don't have siblings, because they don't know how to share. They don't know how to cooperate. So the answer to your question is yes, incorporate. Plus it helps them maintain their weight. Exercise is wonderful for the body and the mind. They sleep better. They're less cranky, less angry, and more tolerable to deal with stress. Wonderful stress management. Anybody want to add?
I just wanted to add that, unfortunately, I remember when I was a child, we had recess, and that was the time to run around, and we would do it for 20, 30 minutes. And we play all kinds of games, you know? So it was not only that, you know, working out and being active, but practicing socialization skills, taking turns, sharing, all this kind of good stuff. But unfortunately, nowadays, kids don't have recess anymore. You know, the recess is when they go to PE. So I love, you know, if something like that could be actually, you know, brought back to the school system. Kids having, you know, games and sports, you know, as part of their, you know, their time, you know, while they're in school. And not be academic.
A place to release, Professor Lascano. Because play therapy is wonderful. Playtime is excellent for everybody. All right, it looks like we're running out of time. We have 2 questions. Let's try to tackle them both. I used to work for a tennis academy in Puerto Rico during the summer. One of the things that I've dealt with while working with these upcoming pro and or college tennis players is the lack of awareness and understanding of what they are going to endure and go through. In general, once they go pro, like Osaka, whom she was not expecting such pressures. It's from society as a celebrity and a personality in her life. What would you suggest to the athlete's support system?
I think for this question, it's so important because, like I mentioned before, especially in American culture, there is such that focus on achieving your goals, and especially like fame, right? Celebrity and fame, that everything is going to be great. Finances are going to be great. You know, I'm going to be this star. And that can all be true, but we then don't look at the other side, kind of like Dr. T was saying earlier about balance. Right? So we see all the great things that can come with it, but then we leave out all of the negative or harder, more difficult things, which I think is exactly what this question is addressing. And so I think as a support system for someone who is, especially a professional athlete or anyone else, to have conversations to talk about the pros and cons and perhaps come up with a plan, you know, prevention rather than intervention of if and when things get tough and aren't all glitter and glamour like we thought they would be, or at least not 24/7. How do you plan on dealing with that? And what can I do to help support you if those things occur and happen? So I think it's having conversations, not just pushing it under the rug or thinking that's not going to happen to me. I'm going to get all the fame and none of the, you know, fatigue, so to say, and just having conversations and being realistic and going again back to that balance.
Excellent, Dr. Popham. Oh, we don't have time, but we're going to squeeze in this last question and then we're going to end. This is from Kevin to Dr. Castro. Dr. Castro.
No doctor, no doctor.
That's what Kevin called you. How do we, as instructors and coaches, tell when an athlete is having psychological stress and when the signs, which is a wonderful topic of warning signs, are not there, but we feel something is off?
Great question. And it resonates with me because I coached high school baseball for many years and I was blessed to have some great players that moved on. The first thing is when you spend, like a teacher, when you spend 9 weeks, 18 weeks you see patterns in a child, in a player, as a coach, you see patterns. A lot of these kids, like what all the great panelists have said, are not going to come out clearly and tell you, hey, I'm having problems. They're not going to go out and tell you. But you as a coach, and I think this gentleman is a coach, you have to be a little bit more aware if there's no signs and symptoms, but something's off. Like you see him every day in practice. So if something's off, you could tell he's tired, he's not sleeping, he's not performing well. So he's decreasing his skill set. Then I would pull him aside, which is what I used to do with my athletes. I would pull him aside, break that barrier, ask the courageous conversation question, what's going on? And then that would take it from there. And that once that rapport as a coach and a player is built, then they could tell you not only what's going on the field, but a lot of things, especially, I don't know what type of coach, what level, but in high school, there's domestic violence at home, there's no food at home, they didn't sleep at night, a lot of kids didn't have places to stay, and they still have to be at school at 7 in the morning to do academics and then to go onto the field. So imagine all those stressors. So as a coach, depending at what level you're on, as a coach, you are a coach and a friend and a person to listen to them. And once you listen to them, you're going to be able to help them out, because then you could guide them on what it is that they need.
Wonderful, Dr. Castro. So, warning signs, be attentive, intervene, and say what's up.
Right.
Wonderful, guys. I wish we had more time. We're going to come to our ending now. Professor Lascano, Dr. Popham, Dr. Tourgeman, Dr. Castro, Orlando. Thank you. Thank you very much, everybody. Thanks to everyone who logged on and participated. If you sent questions and we didn't get to it, which I think I tried to get to them all, send this to us again via Facebook or Instagram, private message, and our social media team will direct it to us. We'll try to answer it as soon as possible. If anyone is interested in additional resources related to the topics we discussed or anything you're having trouble with, the Albizu Clinic offers mental health therapy via telehealth services at an affordable price. It helps you. It's a wonderful clinic. No health insurance is necessary, required. Please visit clinic.albizu.edu for more information. We had a wonderful meeting, crammed a lot in. Bottom line is weaknesses, pressure, vulnerability, exposing the need, preventive care, aftercare. What do? We talk about it. We address it. We talk to the support system. Wonderful panelists today. Wonderful questions. Thank you guys for allowing me to be a moderator. It was my first time. I loved it. Everyone have a good day. An excellent job. Bye-bye.